Everybody, welcome to another Team IBS Dietitian live. Let me see. Today we're going to talk about food triggers for IBS and why it is so confusing and what you can do to maybe better understand what type of triggers are out there for patients with IBS, what symptoms you experience with those kind of triggers, and maybe how. Oh, so many people are joining us already. Ola, where are you joining us from? Can you put it in the comments? Yeah. Hi. Okay. Oh, hi, Brooke.
Hello.
Okay, there's a bit of an echo. I think you might have to mute one of the devices. Hi, everybody. Hi from Dallas, Texas. Seal Beach, California. I actually don't know where Seal Beach is. New York. Hello, hello. Food triggers for IBS. So we'll go through the different types of triggers from IBS. New Mexico, hello. Drop us your questions in comments and we'll go through them later.
Am I still echoing?
No, it's good.
Okay.
Oh, actually it is still. Can you guys hear us okay? Is there any echo? I think it is, I hear my voice, but let's see if the audience hears it.
Okay, wait, let me turn down this.
Yeah, I'm gonna have to turn down one of them. But we want to make sure people can hear us well on Instagram.
There, is that better?
Yeah, that is better. Okay. And people are saying there's no echo. All right. Well, thank you everybody for joining us. And today we have here, that is Brooke. Brooke, you wanna introduce yourself?
Sure, I'm Brooke. I'm a registered dietitian with Team IBS Dietitian. So I work closely inside our IBS Freedom program to help people identify food triggers and get back to eating with confidence. We've also got Jessie from our team here as well. She is our founder and creator of the IBS Freedom program, and she's also part of the care team that supports through food and some meal planning and reintroduction.
Hi,
So
everyone.
today
Yeah.
hello. Today we're going to dive into the biggest question we get: how do you actually figure out which foods are triggering your IBS? So we'll talk about what really causes IBS flare-ups and how to find your food triggers and when to consider medical support.
Yeah, and we are really glad that you are here to join our live chat, and then we'll answer your questions at the end. And before we begin, I want to share a quick disclaimer. Everything we discuss today is for educational purpose only. It's not meant to replace personalized medical advice. Everyone's body is different. So please check in with your healthcare provider before making any major diet or medication changes. And this session is sponsored by Ardelax, a company dedicated to supporting education and awareness around IBS constipation and digestive health. And now let's dive into why food triggers, why identifying a person's food triggers matter, right? And here's where we would say most people we meet coming to us will be saying, I've tried everything. The gluten-free diet, the dairy-free diet, low FODMAP diet, sugar-free diet. Sometimes they even go vegan or paleo, and they are still bloated. And, and a lot of the cases, right, people have cut out so much fruit already. And it's really just about one single food causing your symptoms. And when you don't know what triggers your symptoms, it's like shooting in the dark. You make changes without knowing what's actually helping. And the problem with that is people will shrink their diets because they get so anxious with food and they shrink down their diets to just a few safe foods. But symptoms still persist. That's when we know it's time for a structured guidance. Well, actually, we know it's a structured guidance from the get-go, but most people don't realize they need the structured guidance from the get-go. They think that I can try diets because it's easy, it's available, it's something you can do, but the problem is diet is actually quite complex. So we're going to talk about the different types of triggers so that you have a better understanding of, what you may or may not need to cut out and when you should have this conversation with provider. As dietitians, we see people who come to us with just a few foods they feel safe eating. That's too late. We really don't want people to be cutting out more and more food and still feel bad about their symptoms. And then they continue to cut out more and more food. We really want people to start, the reintroduction process, or maybe a structured elimination process earlier on, and then do a structured reintroduction process. So, okay. Most people don't actually know what's triggering their symptoms. And remember, it's not always food, right? Because some people, yes, somebody is saying, I think IBS is more psychological than have anything to do with food. So this is where we do refer out to GI psych. We do see a lot of people who actually have food triggers, but there is two components to IBS, actually multiple components, right? But if you break it down, food is one component, psych is one component. The more anxious you are, the more likely you're going to have a flare-up. And for a lot of people, they blame the flare-up on food and they cut out more food. And when you cut out more food, the more anxious you may become. So it's a vicious cycle and you really need to work on both ends for some of the patients. But the goal is not get to that point when you've cut out so many things and become very anxious. Do we want to... before we dive into the different types of food triggers, right, I want to share quick, maybe 2 client stories to give you some background of what it looks like with working on, identifying food triggers, and whereas some people may not have a food trigger. So one of our past clients, her name is Karen. Karen came to us very bloated. She was in pain all the time. She had so much pain that she actually went to ER multiple times. She's been to multiple doctors, and she's even seen GI dietitians. And at the end, nothing was really helping. And they just told her to cut out more and more food. And she went to a naturopath after that and cut out even more food. She came to us gluten-free, dairy-free, low FODMAP, and just have cut out so many things that she thinks triggers her symptoms. Right. So when she came to us, the first thing we did is to really understand, what's going on in her gut. And it turns out a lot of her pain and the gas was actually caused by significant chronic constipation. She knew she was constipated. She was already on medication for constipation, but just the extent of the constipation was causing her a lot more symptoms. Now, she came to us already on a lot of diets. We actually stopped a lot more of the diets that she was doing. So we got her off of dairy-free, we got her off of gluten-free, and we only focused on low FODMAP diet, which we'll talk more about in a little bit, but give you some more context. But what we also helped her with was also improving her gut motility, so that she was pooping every single day. And when I say improving gut motility, it's also multi-steps. I'm not going to go into all the detailed steps here. But once we improved her motility, she was having proper full evacuations every day. Then we did the structured FODMAP challenges to challenge all 11 groups of FODMAPs to see if she responds to any of those groups. And it turns out she did react to 2 groups of FODMAPs. One is onion, which is GOS, and fructan. Is that right? No, it's only fructan. No, it's only fructan, sorry. She reacted to onion in larger quantities, right? So we do a 3-day challenge. She tolerated the smaller quantities. But if it's a larger quantity, she reacted to it. Then she tends to be more backed up. She has more pain, but she knows how to manage because she knows onion triggers her symptoms. And another group was actually lactose. But it doesn't mean she has to go completely dairy-free, but maybe maintaining more lactose-free diets will help her manage her symptoms. So this is an example where somebody actually have a food trigger, right? In cases like this, you need to identify which one it is because, like I said, she only had 2 groups. All the other 9 groups of FODMAPs, she tolerated them okay. In fact, most of these FODMAP groups actually help her have better bowel movements, especially the ones that are more osmotic based, right? The sorbitol, the mannitol, and the fructose. These actually help people have better bowel movements. And for somebody with IBS-C, it is encouraged to eat more as long as you tolerate it. So what we did for her, as you can see, is she came to us gluten-free, dairy-free, low FODMAP, cut out a lot of things, and we were able to reintroduce everything and only identify 2 categories of FODMAPs where she didn't tolerate at a higher dosage. But she knows now exactly what she can tolerate and what she doesn't, and how much of it she does. And she can still eat a small amount of onions and knows exactly how to manage it. So that's case study number 1. Now, case study number 2 is one of our clients, Erica. Both of them actually have gone on IG Live with me if you want to find it, or maybe go to YouTube to watch it. But Erica, again, came to us with alternating bowel habits. She had constipation and diarrhea sometimes, and her diarrhea flare-up got worse and worse. And it was impacting her life. I remember when she came to us, she just finished the trip in France with her husband. She couldn't even enjoy the trip because she was so worried that she's going to have a flare-up. And what happened was, when she finally decided to come work with us, what we realized was she got very constipated, leading her up to having enormous flare-ups of diarrheas. These are the diarrheas where you would be in the bathroom for hours and a lot of stool comes out because there's just so much stool backed up in the colon. And she would feel really exhausted for a few days after that. But what we did, again, here's what we did. We regulated her bowel habit. We really make sure she has a full evacuation every day so it doesn't lead to the significant backup that she was having prior to it. And her diarrhea stopped. And then we reintroduced all of the FODMAP groups. And guess what? She did not have any food intolerance. And what she really needed to do is to make sure she has a full evacuation every day. And when it comes to gut motility, right, this is where we really talk about how to improve your gut motility, whether it is for constipation or for diarrhea, right? For constipation, we want it to be faster. For diarrhea, we want it to be slower. And there are a whole host of tools that we can do. But I want to share these 2 stories with you because we are talking about food triggers. And I want to make sure everybody knows that not everyone with IBS has a food trigger, right? This is very, very important because on the internet, you see people telling others, I'm signing because they usually speak with so much confidence that we just wish we have, right, Brooke? It's like, oh, you need to cut out sugar because it it fits into candida or whatever. I'm like, no, candida is a made up. It was one of the questions we got over the weekend with the Q&A. So sugar is not, not a real food trigger for most people, but there is a specific subgroup of people who may have sucrate isomaltase deficiency. Then those are the people who tends to react to table sugar. But this condition is very rare, and usually physicians catch it when the patient is young, because this tends to be genetic and it starts at a very young age. Do we see cases in adults too? Possible. It's not something we have seen, but it is a condition that we always, keep it in the back of our head if patient is not improving with other approaches. But actually, yeah. So let's go through common food triggers, right? Do you want to kick off our number 1?
Yes. So as Jessie's been discussing, high FODMAP foods, which are fermentable carbohydrates, so they get in your gut and they can ferment, which can cause gas and bloating and diarrhea, sometimes constipation. And these would be the most common food triggers that we see. Things like onions, garlic, wheat, apples, and certain beans are some of the foods that are high FODMAP. Now, that certainly doesn't mean that these are not healthy foods. In fact, they can be very healthy, but your gut bacteria really likes to ferment these guys. And like I said, cause that gas, bloating, and pain. So it's not necessarily about what is a good and bad food, but it's how your individual gut handles it, which is why this is such an individualized process. Jessie, do you want to take the fatty foods?
Yeah. Actually, I want to kind of expand on the FODMAP foods a little bit. So while the low FODMAP diet is, the most studied, right? We know it has about, what is it, 60 to 80% efficacy or seven, depending on which research we look at. It's very high on the efficacy list, and we see that it being recommended left and right. PCPs are recommending them, GIs are recommending them. But, it is not as simple as just cut out the food and see if you feel better, right? You have to, one, cut out the food appropriately, and really you should only be on it for 2 to 6 weeks under the guidance of a trained dietitian, and then do systematic reintroduction if symptoms are improved. Where we see the problem is it's being recommended to say, oh, try it, see if you feel better. And people will feel better when you are cutting out so many foods. And the problem is the reintroduction phase, right? Most people don't know how to reintroduce, and they continue to cut out those foods. And what we see is people being on low FODMAP for many, many years, and they cut out more and more food, and they may still not have full symptom relief, and they don't, and the microbes ferments the FODMAPs, which can cause a lot more gas, which can trigger pain. However, the key here is FODMAPs are prebiotic fibers that feeds our gut microbes. What does that mean? That means they're good for us, right? At the end of the day, we do want our gut microbes to be thriving, to be happy. And how can they be happy? They can be happy when we feed them a wide variety of fibers, and FODMAPs included. FODMAPs are short chain fibers that is readily fermentable, but the key is to identify, which group you don't tolerate and how much of it you don't tolerate. So you don't cut out all of the FODMAPs, because it is a very difficult diet. Especially now that we're looking, right? Thanksgiving is coming up, Christmas is coming up, New Year is coming up, a travel season is happening. How do you maintain a low FODMAP diet when you do all those things? And most of the time when people are maintaining a low FODMAP diet and doing all those things, they're still worried about having flare-ups. So remember, if you've been recommended the low FODMAP diet, it is temporary. It should really be 2 to 6 weeks. And then the reintroduction process kicks in. And what do we do during those 2 to 6 weeks? It will bring a symptom down a little bit. And what we usually do is we spend that time to investigate what's going on in a patient's gut, right? Like the examples we shared earlier. That's the time when we say, oh, you are actually very constipated. Let's work on, improving your gut motility. Or let's say, oh, you might have, this going on. Let's get you tested, right? When I say tested, we mean test that your doctor will order for you, not a random test that you purchase. Anything that is directly sold to consumer, they are scams. I shouldn't say they're all scams, but just beware. There is a reason why your physicians are not recommending them, and beware of alternative medicine, because we have seen so many things. Do not do the food sensitivity test. That's a big one that we see. Do not do the gut microbiome test. That's another big one that we see. We just started a group program last month, and we still have new people joining it this month. And we have seen so many people done those tests that are not legitimate, and they wasted a lot of money. They wasted a lot of time not actually addressing the real problem. So be very careful. I'm getting off track with the FODMAPs, but we've got some good questions about the FODMAPs here. Well, somebody asked, let's address this. Somebody asked, what if you don't get relief in that first 6 weeks? Well, you really should be seeing your dietitian sooner. If you're starting out, usually what the process of the low FODMAP diet is, you are recommended a diet, you should go see a dietitian to learn how to implement the diet. That's your first session with. Right. Brooke, I'm back on live on Instagram. I actually ended the previous one and I'm back on. I think it was my computer. Not my phone, or my connection had some issue. Okay, I see that you're here. Do the share about the alcohol thing one more time with people watching on Instagram because they were probably waiting. Hi, everyone. Sorry, we had a internet connection issue. We have no idea. It was an Instagram issue, but we are talking about food triggers for IBS, and we just talked. We talked about FODMAPs extensively in the previous video, so you can go watch it. And then we also talked about fatty foods that can trigger symptoms. So, and also caffeine and alcohol. And Brooke is talking about alcohol. Brooke, say what you just said again.
Yeah, so alcohol definitely can be a trigger, and if you're drinking regularly, it definitely be a good idea to cut back for a few weeks and see if your reintroduction of FODMAPs or any food, it would be a good idea to not be drinking so that you can see if you want a clean slate when you're doing reintroduction, so you know what actually is causing the problem. An occasional drink now and then is not usually an issue. But if you notice that it is, you go out for a big night, have too much alcohol, and the next day your symptoms are much worse, that's a pretty good indicator that alcohol may not be your friend. So that's and that's where the tracking your food and drink intake can be really helpful to narrow it down.
Right. Yes, exactly. And we do see usually a lot of symptom improvement pretty quickly when people like reduce their alcohol intake, especially if they are heavy drinkers. Or sometimes even for some patients with a very sensitive gut, just drinking a little bit of alcohol irritates their gut. So in those cases, we do really recommend maybe limiting it to once a month instead of once a week, or maybe once a day, like depending on where you are in your gut healing journey. Is it absolutely no for some people with a sensitive gut? What would you say?
I think it would be worth cutting it out and seeing if your symptoms improve. And then if you really miss having a drink every now and then, try different. If you're gluten sensitive, having beer is certainly not going to be your friend, but maybe a glass of wine would be better. Or if it's a mixed drink, a lot of times the mixers can be a problem too. So it's going to be a little bit of trial and error, which you can tolerate if anything. So yeah, there's not an easy answer, except that avoiding it is probably going to be the best thing to do, unfortunately.
For the time being. And then you maybe work with your dietitian to see, like what you were saying, right? What are the options that may trigger less symptoms for you, depending on a person's individual trigger. Okay, next topic is one of our favorites, fiber. Too much? Too little?
Fiber. Yes. We do see a lot of extremes. Sometimes we see like 75 grams of fiber a day, and sometimes we see like 5 grams of fiber a day. Honestly, lower is probably more concerning, but certainly if you're having symptoms and you're eating that much, 75 grams, it might be dialing back a little bit, which can be hard if you're like a plant-based eater, and but finding little ways to decrease a little bit. But I would say the vast majority of the time we're trying to get people to increase their fiber intake for sure.
Yeah. Just gonna say hi to my friend Steve there. Yes, fiber is quite interesting because too much fiber can trigger patients' symptoms. Most of the time, we do see patients not getting enough fiber, right? The goal is that 25 to 35 grams of fiber per day, is not even per week. So that's one thing. And then we want fiber variety. Right, we are talking about 30 different types of plant foods every week. So when you add it together, it can be quite tricky, but always talk to your dietitian on how to add more fiber. And what do we usually recommend, right? Slow increases, and then slow increases, and also lots of fluids when you are increasing. Sorry, my kid is knocking on the door there. Do not come in, I'm in a meeting.
That's okay. My dog is barking
No.
at the door.
But slowly increases, what does that mean? That was actually one question we got during our dietitian conference when I talked about chronic constipation and how to treat patients with chronic constipation. What we mean is 3 to 5 grams of fiber, maybe every 2 to 3 days. You really don't want to go over that limit because it can trigger too much more symptoms if your body is not used to having more diet in more fiber. Can you take over for a second?
Sure. Sure. Yeah. So when you're adding, Kate Scarlatta, who is a great dietitian, always says if you're adding too much fiber at one time, it's like adding cars to a traffic jam if you're constipated. It really can continue to back things up and make things worse. So doing, those 3 grams over a few days, see how your body does. And we always want to do fiber from foods first, but it is okay to do a supplemental fiber if IBS is your issue. You probably want to do a non-fermentable fiber. Those are usually easier to digest. And if your fiber intake is inconsistent, like you're great during the week, you can add a little bit of a supplement on the weekends if your fiber intake isn't as good and you notice a difference in your bowel movements on the weekends when you're not as good with your fiber intake. We love fiber, diversity of fiber, as many different fibers and plant foods as you can get is really what the research is showing for a good, diverse, healthy microbiome.
Yeah, it is so important. And while we are talking about different food triggers for IBS, right? Again, what we see is people cutting out more and more food. And then when you're cutting out more and more food, it doesn't help your gut microbiome. And if your gut microbiome starts to lose its diversity because you're cutting out more and more food, it can mean symptoms becoming worse in the future. So, before you embark on any kind of elimination diet, always work with a dietitian and a dietitian that actually understands, the complexity of implementing and elimination diets. Because again, oftentimes we hear patients go to a physician or even sometimes, they're referred to a dietitian, but the dietitian may specialize in diabetes or kidney care or hypertension or heart disease. They are not well aware of GIs. They're not aware of GI conditions and different diets for GI conditions. Then they may not be able to really guide the patient on the right path, right? One is implementing the elimination diet properly. Number two is doing the reintroduction in a timely manner. And number three, like what somebody was asking earlier, is what if I don't see symptom relief after 6 weeks of implementing the low FODMAP diet? You really don't want to wait until week 6 to troubleshoot. You want to troubleshoot as soon as possible. And oftentimes, people will have symptom relief even within 1 week of implementing the low FODMAP diet if they're doing it properly. And when people try to do it on their own, that's, it's sometimes very problematic because they're not doing it properly. Okay, last but not least, last food trigger. So I just want to, maybe we'll do a recap after this one. And this is gluten intolerance, and this could be celiac disease or non-celiac wheat sensitivity, or maybe gluten allergies. So everybody probably already knows what celiac disease is. Celiac disease is an autoimmune disease. When patients eat gluten, their body have a reaction, and it can be a GI reaction. It could also be other reactions as well. Some people report joint pain. Some people have rashes. Some people have brain fog. It's just not a very good feeling in general for patients with celiac. Oh, also the key marker is inflammation in the small intestine. A certain distinguish inflammation in the small intestine. So that is celiac disease. So your body's own antibody is attacking the mucosa lining in the small intestine, causing inflammation, erosion, and what we call like a marsh grade inflammation. And that's, to get a diagnosis of celiac disease is quite tricky because it's a long process and you have to be eating enough gluten during the whole process. So usually starts with a blood work, and then it's an endoscopy with biopsy to the first part of the small intestine. There are very specific areas that they need to go in. I have a video that talks about diagnosing celiac disease. You can search it on YouTube. Just search IBS Dietitian or Jessie Wong and celiac disease. Look for that video. We go in depth about how to diagnose celiac disease. So that's one. And then gluten allergy is another one that is diagnosable. And what I mean by diagnosable is you can go to an allergist and they can do either the skin test or blood test to help you see if you are intolerant, you have a gluten allergy to gluten or to wheat. And sometimes it could be grass, because grass and wheat may cross-react in certain population. Okay, and after celiac and gluten allergy are ruled out, and if a patient still don't tolerate wheat products or gluten, then that is when the patient may get a diagnosis of non-celiac wheat sensitivity. These are people who will never get a positive celiac test. They will never get a diagnosis of celiac disease, but when they eat gluten, they have a lot of reaction. Now, we do want to be careful when we say gluten intolerance, because a lot of people go gluten-free automatically when they have any kind of symptoms. We want to be careful because most people with IBS don't have gluten intolerance. We do know there is a small percentage of IBS patients may have non-celiac wheat sensitivity, but you have to, really identify that with, again, a trained provider. It might be your GI, it might be your dietitian to help you implement a proper gluten-free diet and then do a gluten challenge to see, what reaction you have after that, and usually monitor the reaction. So that it gives you a clear understanding that, hey, I really do react to gluten. Then you can, go on a gluten-free diet and really learn how to do it properly, because a gluten-free diet is probably one of the hardest diets that we have to teach, because gluten is in everything. And if you don't have to cut out gluten, which most likely you don't have to, again, only about 20 to 30% of IBS patients may have gluten intolerance. Most IBS patients don't have that. Then you really shouldn't. You shouldn't be cutting out gluten, or you don't have to cut out delicious food. It is heartbreaking anytime a patient is on a gluten-free diet, because it is really, really challenging. It's hard to eat out. It's hard to even cook for yourself. You need to prep your kitchen to set it up properly for gluten-free. But sometimes, if that is the case, then your dietitian should know how to teach you to implement the gluten-free diet so that you are minimizing your reactions and slowly healing your guts. All right, let's recap a little bit how many different food triggers we talked about. So we started with the low FODMAP diet. Oh, there's one more that we didn't say, sucrose isomaltase deficiency. Do you want to kind of talk about that?
You mentioned it. You mentioned it a little bit in the beginning. It's when you don't tolerate simple sugars. It's pretty rare. I think I've only maybe seen it one time, because it's usually diagnosed in childhood. But you can trial a diet and medication to see if that helps you digest simple sugars.
Mm-hmm.
But it's very, very rare in adults.
It's very rare. And if you hear people say you need to go sugar-free for your IBS, you don't need to go sugar-free, but you need to know what's triggering your symptoms. So we talked about high FODMAP foods. We talked about sucrose intolerance, so that's simple sugar intolerance. We talked about fatty food and fried food, caffeine, alcohol, artificial sweetener, sugar alcohols, and fiber, and celiac and non-celiac wheat sensitivity. So we talked about 9 different types of food intolerances today. And again, we also talked a lot about tracking, right, and identifying your symptoms. The end goal is always to help a patient expand their diets, right? Once you identify your triggers, then you can safely add other foods back into your life, which is what we see a lot. But we really hope patients, don't cut out all the food first before they go see a GI dietitian, because at the end of the day, you may not need to cut out all of those. We might just say, well, we suspect this, let's cut this one out. Because what we can do is look at your dietary pattern and your symptoms, and then see, what may be triggering symptoms and what type of symptoms you have. If it's more gas and bloating, we might say, why don't we limit certain types of FODMAPs? If it's more loose stool and diarrhea, ideally, we don't cut out all the FODMAPs. We just cut out more of the osmotic ones. And Yeah, don't just rely on a one-page handout from your GI doctor. Get a free guide, at least learn more about it. And also at the beginning, somebody was commenting and said, it may not be food. And we 100% agree with you. Not everybody has a food trigger. Sometimes it's the gut-brain axis. It's a stress response. Sometimes it's a motility issue, right? It could be why, and we would really need to understand why somebody have slow gut motility leading to IBS constipation, and why somebody may have really fast motility leading to IBS diarrhea. Anything else we want to talk about before do you want to share some maybe practical tips for preventing flare-ups before we go into Q&A?
Practical tips for, I'm trying to think.
It's number 6 on our thing. Yeah.
Eat, eat slowly. So a big kind of healthy habits would be eat slowly, chew your food really well. Digestion starts in the mouth. So of course, the more you chew, the more you give your body a chance to like produce all the correct enzymes to help digest. Spread your fiber evenly throughout it doesn't have to necessarily be super even, but spread your fiber throughout the day, eating 30 grams of fiber at breakfast and then no fiber the rest of the day. Probably not your best habit. And avoid skipping meals to work with how your body digests. Keeping regular meal times can be important. Managing stress is a big one that we do in the group program, with some deep breathing, some gut-directed vagus nerve kind of stimulation. You really want to maintain or improve hydration. You really need, if you're on a constipation medication, you really need to stay hydrated. If you're having diarrhea, you can be losing fluid through your stools. You also want to make sure you're hydrated. And really try not to overly restrict for a long term, because we don't want to make things worse by having too much of a restricted diet.
Yeah, I kind of want to touch on the avoiding skipping meals part. Our guts really thrives on regularity, right? They like routine. They really like routine. So, stick with regular meals. If you do 3 meals a day, good. If you are more constipation based, you really want to stick with 3 good meals a day. If you're somebody who may have more diarrhea or faster motility, you can spread it out to maybe 4 to 5 smaller meals a day. Mm-hmm. So that it helps improve your motility and your symptoms. And why 3 bigger meals a day for constipation is because of gastrocolic reflex. When we have food in the stomach, it sends a signal to our colon to say, hey, food is coming. You have to go to the bathroom. So so we are trying to utilize gastrocolic reflex to have better evacuations for patients with IBS-C. But if you are on the other end of the spectrum, right, if you have more diarrhea-based symptoms, then we want to reduce the stimulation from gastrocolic reflex, which is why we would recommend maybe smaller meals throughout the day so that we don't stimulate your gut as much. And managing stress, that is such a key point to IBS because, again, it's our gut-brain axis controls our gut symptoms, right? It's a feedback loop from the brain to the gut and the gut to the brain. And we know with the gut, it's a lot of the times your gut microbiome talking. And your gut microbiome thrives when we are eating a wider variety of food. It does not thrive by cutting out more and more food. For those of you who may be already, self-eliminating some foods, remember, you don't want to do it long term. You really want to identify your own trigger before you cut out more and more food. Because it can shrink the presence or shrink the diversity of your gut microbiome. It's okay.
He's annoyed I won't let him in.
Oh, poor thing. I thought he was jittering in his sleep. You know how they sometimes do that.
No, she's quiet. It's the little one that's not in
little
here.
one. Okay. But yeah, with cutting out food. Okay, we have some Q&A that was dropped in our Facebook group. There was one about protein powder for bloating. I want to kind of talk a little bit about that because, so the question was, let me see, can we recommend a protein powder that won't trigger bloating? And I want to just say that really quick. This is one of the questions we get so often. Now, the key here is to really understand what's causing your bloating to help you pick out the right protein powder, right? If, for example, if you are using whey protein, and if you don't tolerate lactose, it could be the lactose affecting your bloat, right? But lactose may not be a problem. For some other people, it might be the added fiber. It could be high FODMAP fiber that's added to the protein powder that can trigger somebody's bloat. So, is it the lactose or is it, maybe the high FODMAP fiber? And then sometimes it could be artificial sweetener that is in all protein powders these days. So if you don't know what is triggering your bloat, it's hard to choose the right one. And it's also very hard for us to recommend one that covers all grounds. Mm-hmm. But it is okay to use protein powder, try different ones, maybe get the smaller serving and see which one works better for you. Again, don't just cut out food because you think it is the food causing your symptoms, because again, it may not be the food causing your symptom. Let me see. Oh, somebody commented on Facebook and said, Facebook fiber makes me worse, really constipated. Yeah, like what Brooke was saying, imagine a traffic jam, right? If you pour more fiber into it, it can make it worse. Mm-hmm. Okay. Loose stool. We have a question. We have multiple questions on explosive diarrhea and gas in public. Can you guys give tips on how I can deal with explosive diarrhea and gas in public? This is a complicated question because, again, we need to understand what is causing the explosive diarrhea, right? Are you very, very backed up causing you to have explosive diarrhea? That's one reason. Usually the very backed up cases are the cases with a lot of gas as well, because, if you're backed up, the stool is fermenting in the gut, that causes a lot of gas, and that usually is trapped gas if they cannot come out. And when, your body finally lets it all out, it can become very explosive. And this is usually where people would have, maybe diarrhea for a few hours or even overnight when everything just comes out. And then, so that's one type of diarrhea that can lead to explosive diarrhea. Another one I'm thinking of is fat malabsorption kind of diarrhea, where, it's, people might have multiple diarrhea a day and you will see some fat floating on top. It's kind of very urgent. Sometimes in cases that we see, people have to be wearing diapers to prevent an accident from happening. And in those cases, right, talk to your physician, talk to your care team to see if you can trial some medications that can help you slow your gut motility down so it doesn't lead to that point. Or trial some medications that can help you better break down fats and absorb fats so that we reduce the fat content in your stool to help not having those kind of incidents. So again, it really depends on what's triggering it. And then of course, another one that we see is FODMAP foods triggering it, right? Especially the more osmotic FODMAP foods. But again, don't just cut it out. Cut it out and reintroduce so that you know what's triggering your symptoms. Mm-hmm. Yeah, how to keep myself from pooping in public places is very hard. You really have to know what's causing the diarrhea. We actually have a podcast episode that talks about different types of IBS diarrhea. Because, if you don't know which type, like we said earlier, right, is it triggered by malabsorption? Is it by fat malabsorption? Or is it by food intolerance, like FODMAP intolerance or gluten intolerance? Or is it triggered by maybe even sometimes sugar alcohol and artificial sweetener? Like, you need to know what triggers it. These are just some food examples, and sometimes it may not be food. It could be anxiety, right? If it's anxiety, then we really refer to GI psych. I think, if you are having accidents in the public and you're very anxious about it, it might be a good time to see a GI psychologist. So these are people who are specialized in helping GI patients. One is calming their mind. They can work with you on cognitive behavioral therapy. They can also work with you on hypnotherapy, gut-directed hypnotherapy. And guess what? Hypnotherapy can be a very useful tool. There's an app called Nerfa out there that can be helpful. You can try it. I know their subscription has changed. I think now people can only buy 1 year subscription. You cannot try it. You cannot, do the 16 weeks. That was what the research was done on. But take a look at all these other tools. But the key, again, maybe keep a symptom tracker, food tracker, bring it to your physicians, have them evaluate everything, or bring it to your dietitian, right? Who knows your case a little bit better, and then they can analyze your food intake when symptoms happen, and analyze other things, and then refer you out to the right provider. Do you need to see a pelvic floor specialist, right? Do you need to see a GI psychologist? And what treatments may look like, because depending on what your triggers are, it can be very different treatment plans. But if you don't have any clues right now, I would say, we have patients who bring extra clothes with them. That gives them their peace of mind. We have patients that start coming to us wearing diapers, adult diapers, to prevent accidents from happening. We have patients who will put some cream, who will bring cream with them, at all times, because they are having so many accidents. But again, a lot of the times, once they identify what their triggers are, their symptoms will stop, or their symptoms will be way better managed, so that they don't have to bring all of these again. If you go onto the IBS Nutrition podcast, we have so many patients that have talked about their accident experiences. I think Deb came on and said, every day before she goes out, she has to make sure she has changing uniforms, because she works in dental care. They wear uniforms, they wear scrubs. She has to make sure she has wipes, towels, changing underwears. What else? And then sometimes, even cream, just to make sure that area, that area around your sensitive area, your butt, doesn't get too irritated. So these are tools that can help, but ultimately you need to identify what is causing your diarrhea, and this is a conversation you need to have with your healthcare provider. It could be your gastroenterologist, or it could be your dietitian. Now, I think one of the big problems we hear a lot is finding the right provider that listens to you, right? And sometimes I think going into your provider appointment with a list of symptoms that you notice, right, that you are tracking, will give them a better idea of what is going on and how to create a treatment plan that can actually work. If you go in and just say, I have accidents in public, I don't know what to do, it's hard for them to give you the right treatments or even order the right tests. So we have a free symptom tracker as well. You can comment on any of my posts on Instagram, symptom or pain, and I will again ask you 2 questions in your DM, asking for your name and email, and it will email you the tracker. And what the tracker does is so that you can write down the symptoms you have. Do you have pain? What type of pain it is, right? Is it sharp pain? Is it dull pain? Is it cramping? Or is it, constant pain? Like, what are different types of pains out there? Write it down. Where does it happen in your body, right? How long does it last when it starts happening, and how frequently does it happen? So that's one thing to document. If you have bloating, you want to document your bloat. Again, where the bloating is. How long does the bloating last? How often does it happen, and does it associate, or does it correlate to what you're eating, or does it correlate to your bowel movement? These are things you really want to track. And then when you're tracking it, you bring it to your healthcare provider, and they can look at all of these and be like, okay, here's what I think may be going on. Let's order these tests for you. And then let's see, how you respond. And these are a lot of the times what we do. I feel like as dietitians, right, we are, looking at the full picture, and then we're making recommendations for patients, physicians on, hey, these are the tests we want to see performed on our patients. And then another thing we always have our patients get is nutrient labs, right, to see if there's any deficiencies. If there's one deficiency, then maybe we are like, okay, let's look at what you're eating. Are you eating enough of the foods that can, replenish your, is the deficiency caused by not eating enough of the foods that can provide you that nutrient? Or when sometimes we see multiple deficiencies happening, then we really need to ask more questions, get more tests done. It could indicate something else is going on. And sometimes it could be celiac. Sometimes it could be SIBO, small intestine bacterial overgrowth. We actually had a question on SIBO. We're not going to dive deep into SIBO, but we have a podcast episode on SIBO. go listen to it, go look up IBS Nutrition Podcast, learn more about it, because you don't have to cut out foods necessarily for SIBO. Low FODMAP diets can help maintain symptoms. It's not going to cure your SIBO. So beware. Do not cut out food for long term. But then also we as dietitians, we are also coordinating care. We are coordinating with the patient's PCP, we're coordinating with their GIs, and then sometimes we refer out to GI psychology, and then sometimes we refer out to pelvic floor. I feel like, with IBS, the more you understand the condition, the better you can coordinate your own care. If you can't do that, make sure you work with someone who can help you. That's just something we do as dietitians, because we see our patients a lot more often than our patients see their providers. And of course, it's relatively more affordable to see a dietitian than see a specialist, but your specialist should ideally be the person coordinating all the care. However, the way our insurance reimbursement structure is in healthcare model in the US, it just doesn't allow them enough time to do all of this on the back end. So we kind of pick this up and kind of go with it. Somebody had a question about vitamin D and potassium are my two most difficult. So potassium deficiency is not something we test for. It's on the metabolic panel. It's usually tightly regulated. You shouldn't see a deficiency. Make sure you are checking it with a legitimate provider. Don't go to a naturopath, because their labs may not be accurate. Vitamin D is one that we see commonly deficient among IBS patients. It could be an intake problem. It could be a sun exposure problem. It could also be an absorption problem. So make sure you're talking to your provider so that you identify, what is causing your low vitamin D levels, and not just, blindly supplementing. But if it's low, definitely create a plan with your healthcare provider and to check it again to make sure you are not deficient. Maybe 6 months down the road if you are starting to supplement, but it's something you really need to talk to your provider about. Okay, what other questions do we have? And the question about how do I deal with IBS in public, it is so hard. It is very hard. We don't want to just write you off and say that it is not hard. It is very hard, especially if you have the diarrhea type. I mean, I'm not saying constipation is not hard, because you know what? Constipation is really hard too. And you've got to make time for your bowel movements, and you've got to do all these things to make sure you're having bowel movements. But diarrhea can be extremely debilitating, because you don't know when it will happen. You don't know what's going to trigger it. You don't know where you will be when it happens. And it makes people afraid to leave their homes. And we hear that a lot. So I just want to let you know that, don't give up hope. If that's something you're struggling with, go listen to our podcast on different types of diarrhea, so you can hopefully help you and your provider better identify what type of diarrhea you have and get you on the right treatment plan, right? Treatment, there are so many ways to treat diarrhea, depending on what it is. If it's a food trigger, then you may have to, cut it out, or maybe only eat the amounts that you tolerate. If it's not food related, there are other tools you can do. There are medications that you can use. There are psychotherapies that you can do to help, slow down the gut motility a bit more. What else was I thinking of? Anything else you want to add? But it is really hard having IBS diarrhea.
Yeah, I think, I think you covered it all. I do think if there was a comment about SIBO and the diet for the doctor sent the person home with just saying do the low FODMAP diet. If you've done it for 6 weeks for SIBO, I mean, low FODMAP diet can help with the symptoms of SIBO, but it's not going to treat the SIBO. So you need to go back to the doctor and tell him that it did not manage the symptoms. But yes, yeah. Jessie is for sure. We dive much deeper into that in podcasts. So that would be a good place to start to kind of inform yourself about the SIBO.
Mm-hmm. Yes. And the same person also said, for me, carrying pads and extra clothes give added measure of security. Yeah, those are really helpful, right? Mm-hmm. Yeah, it's tools to help you feel better and feel, more secure. And that hopefully can translate into reducing anxiety when you're going out. And we also have people who plan their routes out everywhere they go just to make sure, there is a bathroom nearby if they need it and they know exactly where it is. That again, give people a mental security, another measure of security to help them feel better. These are things that will help you feel better. It's not going to treat the root cause of why you are having the diarrhea. So make sure you are treating the root cause. And when it comes to SIBO, right, there are multiple risk factors, and we really dive very deep into that in our podcast episode, and go listen to that. And oftentimes, if you listen to Dr. Laura's episode, she came to us with significant amount of diarrhea, and we actually helped her get to her diagnosis of SIBO with her GI. She worked with her GI for about 5 years. They never got the SIBO diagnosis, but in 4 months, this is what she said in the podcast is, in 4 months, we got the diagnosis, we identified the triggers, and I moved on with my life. And she went on to Croatia for 2 weeks. Was it 2.5 weeks or something? For 3 weeks, where she did everything without worrying about having symptoms. Like, the anxiety is still in the background when we recorded that episode, but every day without symptoms is every day where she knows, like, I'm okay, I can do this. And we also had that exchange of information where we talked about, when she realized her program was ending, it gave her a lot of anxiety. And what Brooke was saying is that we are not going anywhere, it's just your program is ending. And she also said, she had all the tools to manage, any situation that came up. And we recorded, so she finished her program last August. We recorded her episode, I think in May this year. Go back to listen to Dr. Laura's episode. It's very, very inspiring. And we also shared a lot on what we did through the program and help her get better as well, so that she wasn't having diarrhea all the time. Yeah, don't give up hope if that's what you are experiencing. Okay, before we end, we want to say thank you so much, everybody, for joining us today. We hope this is helpful for you, better understand different types of IBS food triggers out there. We talked about 9 different IBS food triggers. I think when people are given the low-FODMAP diet or come to work with a GI dietitian, their expectation is, I'm just going to do the low-FODMAP diet. But no, when you come to work with us, we are looking at 9 different triggers in the back of our head. But we are not going to tell you to cut out all 9 things. We'll start with 1, or we look at what you are eating, what your symptoms are first, and then we recommend 1 or the other. And then we may add 2 together just to cover our bases, depending on a patient's symptom progression. It is always, what we recommend is always dictated by how the patients are responding to certain things. We don't just blindly put people on a ton of restrictive diets. And so, if you've been cutting out food for a long time, go back to your GI dietitian and let them know what's going on, and ask them, for different recommendations, because low-FODMAP is not one size fits all. It's not going to cure everybody with IBS. Does it help manage symptoms? Absolutely. Is it going to be good long-term? No, it's not going to be good long-term. FODMAPs are good for us. They are prebiotics for our gut microbiome. Don't just cut them out. Okay. Again, thank you everybody for, joining us today and spending time with us, learning all about IBS food triggers. Our next live will be in November, and according to our Facebook poll, we have an IBS community for women. If you are new to here, you can join our community. It is free for anybody to join. It is really a safe place for people to share, their IBS experience. However, this space is only for women, so it's not for men. Please don't join if you are a man. But there are plenty of other IBS support groups out there. But in our group, we want to make sure, we are giving you a voice, a safe space to share your story. And we are seeing a lot of people share their stories. It's heartwarming. And it's very encouraging too, right? When people are sharing what they're struggling with, and also sharing what works for them and what doesn't work for them. Okay, so if you haven't joined us, go join us in the IBS community for women on Facebook. It is a private group. You do have to request to join and answer a few questions before you can join. And then the third thing is the polling. So we did a poll to ask people what topics they're interested in. So food trigger was the number one. So we did it today. And then the runner up is IBS constipation. So we are going to talk more about IBS constipation and gut motility in our next session, which is great because I just did a conference. Well, I just booked at a conference teaching other dietitians on how to help patients, improve their gut motility. We can, definitely talk more about that in our next IBS Live. Mm-hmm. And again, we want to thank Ardilex for supporting IBS awareness and supporting this free education for our patients. And, IBS warriors, you can take your life back from IBS, but you need to know what is going on so that you have the right treatment and the right tools to better manage your symptoms. I hope this is helpful for you, and we look forward to seeing you next time.
Bye.
All right. Bye, everybody. Thank you.